So Monica's got something. I'll read that in a minute, Monica. Sorry, but lock and glue tummy tuck versus standing tummy tuck. What's the pros and cons? So yeah, but I don't want to say standard. No tummy tuck standard. Some people are given names like Brazilian tummy tuck, lock and glue. Then it's kind of names. You want to think what exactly. Sometimes people say, "Do you do the Brazilian tummy tuck?" So let's say, "What do you mean by that?" And often they don't know what they mean by that. They don't know what they're kind of asking for. So a lot of things they talk about in a Brazilian tummy tuck, for instance, is what we do. The only thing we don't do is liposuction of the upper abdomen, but certainly narrow tunnel centrally. Anyway, we're not talking about Brazilian tummy tuck. We're talking about lock and glue. So yeah, the benefit of the lock and glue is that it is quicker, and I don't do it, so I guess you should speak to someone who does it for the benefits. But I can tell you the reason that I still use drains and I use quilting sutures. To be honest, I'm probably thinking whether I need to use drains with the quilting sutures, because the quilting sutures do a good job and I like the quilting sutures. So probably could think about not using drains, but it's one of those things where it's difficult. Surgeons often get kind of entrenched in their ways, so I'm still using drains, but the quilting sutures is what I do, and drains is what I do instead. And I prefer to be able to sort of put individual sutures in the lower abdomen to close it, which admittedly does take quite a bit longer, but it's just what I've always done and it's what I prefer. And as I said, I've never really embraced the locking suture personally, but I know a lot of people do use the locking suture, and it is popular, I think, in plastic surgery world. So it's, there's obviously different strokes for different folks. So yeah, I always, say to people, find someone who you think is talking reasonable things and has got reasonable results, and it kind of doesn't matter so much what the technique they use is, because there's lots of different ways of getting good results with different techniques. It's probably less about the technique than the surgeon.